Hello, and welcome to another episode of the Nurse Betsy Show. My name is DeQuasia Canales, and we welcome you for joining us today. So, in the past episodes of the Nurse Betsy Show, we talked about climate change. We spoke with nurses in our hospitals around what's happening with the COVID epidemic or pandemic, I should say, and vaccinations. And today we're talking to some of our special guest members in long-term care. Before I turn it over to Nurse Betsy to introduce her special guest for today, we wanted to provide just a little bit of history about what's been going on. So as you all know, Nurse Betsy has been with us as a nurse and on our team as an organizer now for, is it almost 10 years now, Betsy?
Yes.
It's 10 years. And since then, she's been working as a nurse here in the state of Florida since the 80s. And so we really appreciate Betsy for being active, not only in our hospitals, but in our nursing homes, and really supporting the work that our members do around safe staffing, health and safety. And as we all know, during the past 2 years of this pandemic, all things related to COVID. And so as we get into the discussion around long-term care, I'm going to take us back in time just a little bit to when our nursing home members started to fight for safe staffing levels in the nursing homes in 2001. They were successful. I think Amy was a part of that fight, right? Amy, you remember it?
Yes.
And they did a lot of lobbying. We had changes that happened to bills in order to make it so that our those vulnerable in our community, whether they are seniors or those with disabilities, could get the care and attention that they need to have a good quality of life and to make sure not only that their daily needs, but medical needs were met. Unfortunately, fast forward 10 years, Governor Scott started to roll back and make some of those changes. And here we are once again in another 10-year cycle when there are additional attacks on the nursing homes and the nursing home industry that's really going to devalue the care and the work that our members do. And so with that, I'm turning it over to Betsy and our special guest, Shirley Fiant from the East Coast of Florida and the Miami area, and Amy Runkle from the Gulf Coast, or as you Floridians call it, the West Coast of Florida, over in Venice, out by Fort Myers. And so welcome, strong leaders in long-term care. And hey, Betsy, let us know what's going on.
Thank you, DeQuasia, and thank you, Shirley and Amy, for being on our podcast today. It's very exciting to have you here. You are both certified nursing assistants. And Amy, what's the average number of residents that you take care of in a shift?
Well, at this time, probably between 16 to 20, but during the pandemic, when people were more isolated, that was the worst I've ever seen it. And then the shortage of staffing. I mean, we were lucky to get in there and even get their teeth in their mouth before breakfast. It was just tough. And a lot of them, got depressed and it was just a bad situation. Yeah.
And Shirley, how important is it that they eat? I mean, it sounds crazy, but if I miss a meal, I'm going to be okay. All right. But how about our seniors and how important it is that they get their food in?
The residents need their food. Is actually for nutrition for their body, and that will help them to heal the different illnesses that they have, and also that they be stable also,
Prevention.
Yeah, immune for all the sickness that are around.
Right, because a lot of your residents have a lot of things. I mean, we call them comorbidities, but they have a lot of things, a lot of different diagnoses, right?
Yes.
Right. And that's why it's so important that, and you have a campaign going with the union right now. It's called We Are Essential.
Yes.
Right. Can you tell me a little about that?
Yes. We are essential, and they need to treat us like heroes. It is so that we, as the frontline care workers, we are the first hand the consequences of this crisis in care. Yeah. due to the unsafe staffing, it puts seniors and those of us who care for this resident at risk. We are stressed, exhausted, and too often we have to carry the load of caring for 20 or more residents a shift. That's dangerous.
I was doing a little calculation before the show, and most you work 8-hour shifts.
Yes, 8-hour shift.
Yeah, well, and you should get a couple breaks in that, right? But I was calculating if you had, if you had 20 residents to take care of, that's only like 20 minutes each in 8 hours. And how much, how fast does 20 minutes go?
Fast.
That's 20 minutes is not enough for one resident.
Right.
No.
Yeah, because all the things that you have to do for the resident, to let them brush their teeth, to take them to the bathroom, to bathe them, to get them ready.
Yeah,
All
and these
that
are,
take time.
and as I get older, I do things slower.
Right.
Right? You can't rush them, right? We have to be careful they don't fall. We have to be careful. Like you said, they have respect and dignity. It's not 5 a.m. roll call, right?
No.
That's right.
Everybody out of bed. So what's really important is you've talked about staffing, is this impact of, I know it's been a problem in, and this is what you guys as union leaders have worked on, is we are chronically underpaying our essential workers and benefits for this important job that you are doing. None of us ever see ourselves needing care, right? But how many of us will and do? And so even if it's temporary after an accident or an illness, or if it's our permanent home, it is, you are heroes, you are essential, and you should be paid for that, right? You should have good benefits. So Amy, why is it so hard to get certified nursing assistants to work in long-term care now?
Well, it's hard because the responsibility, the wages, the benefits, they're just not there. I mean, I've been doing this for 39 years now.
Wow.
And I am up on the higher scale, but somebody new coming in, and that's exactly what we need, is new people coming in, because we are short of staffing. But new people coming in, I mean, they don't want to work for $12 an hour. Once they get there, they see the responsibility, they see the time and dedication that you need to have to take care of our residents. And they just, they don't even invest themselves from the beginning. They're like, no, this is not for me. I can't do this. The money's not worth it. I can't take care of my family on this kind of money.
Mhm.
And, it's not, working at McDonald's flipping burgers. I mean,
Right.
This takes a lot of time and dedication, a lot of patience, a lot of heartbreak day after day after day. I mean, this is not easy work by any means. And, we deserve better and than what we're getting right now. So.
And Shirley, how physically hard is this job?
Well, if you listen to all this, 20 patients to one CNA, to feed them, bathe them,
Certainly.
get them ready for appointment, and everything around it. Because sometimes they want you to sit with them and talk. You have to make time also for that. But now with this crisis, you don't have time. So something need to be done about this. We need to get less residents to take better care of them, because they work hard before and they deserve better care.
Sorry.
Yeah. So you cannot just go in and change diapers. No, you have to treat the residents as you want it to be treated. Yeah. Take good care of them, because it could be you in their place, because you have a lot of young people that are in the hospitals. Yeah. So you need to place yourself in their shoes. That because of that, you will take better care of somebody who's laying there in that bed.
What people don't realize is a lot of people are very, mobility is a problem. So you have to help people in and out of bed, in and out of wheelchairs, in and out of lifts. If you have them turning, that takes a lot of toll on your back.
Yes, it's true.
Yes, yes.
And your neck. And
Betsy, not only that is as an experienced CNA, you have to be very mindful, and people need to understand that we are not only just the CNAs, we are also the eyes and ears of our nurses.
exactly.
We have to be aware of head to toe what's going on with our patients, what has changed. I mean, we have to maybe stop in the middle of care and go down and get the nurse and have her come down and check something out. All of that takes time.
Exactly.
And just from getting somebody ready for breakfast, your 20 minutes is gone. That 20
Right.
minutes of the 2.9 or 2.5, they were 5, yeah. And I mean, that's very difficult. And when you rush and you're rushing them, you forget something. Something's gonna pass you by, and not always good will turn out of it. So
And I'm thinking of how important in long-term care consistency is of staff, because in long-term care, many times there's very subtle differences in seniors that you would pick up because you know them, you see them
Right.
every day. Whereas someone he doesn't have the experience, just got there,
yeah,
doesn't know the residents well, may not pick that up, and it could be something like a little stroke or a heart rhythm
Right.
problem. Like you said, you are the eyes and ears of the nurses.
Yeah.
And what are the nurses, they spend a lot of time giving out medication, right?
yes,
Which is time consuming. And so I think it's really important that we know that you are the caregivers. You're the ones that are there 24/7, that are in the rooms, that are, just even seeing somebody have a little difficulty swallowing or
right,
that can be something major, or they could be having a diabetic reaction, right?
Mhm.
And so the bulk of knowledge you have and experience is so important. And like you said, we've been fighting for minimum $15 an hour nationally. And a lot of that has taken center stage with fast food workers. Don't you think people would be surprised to find out that the nursing assistants are making less than that?
Extremely surprised. Yes, yes. When I do tell people, they're like, "Oh my gosh, are you serious?" I'm like, "I am very serious, very."
So one of the I think really amazing things about you two and many others in our union is that you are what we call MPOs. Can you, Shirley, can you explain what a member political organizer is?
An organizer, like to be a leader in the place. You will make sure that everything is okay in the shop. If there is a problem with the workers, that you will go to the administrator and the DON to fix the problem. The problem that we're facing right now with the crisis, that they give the CNAs like 20, 15 residents, then as a leader, you will go and speak up for them. Not by yourself, you go with a group. You're gonna put people together, talk to them, explain them what actually the problem is and how we think that we can fix it. But by going together, we can find a resolution for this problem. So as a leader, you have to stay always on the front page. You're just gonna be the first one who gonna gather everybody and take them to where they have to go to voice their problem. Yeah.
And if I could just add to what she said, we also are what they call a member political organizer, and we call it an MPO. We have to go to Tallahassee. Not only, like Shirley said, do we have to fight inside the shop, we have to go to Tallahassee and we have to stand up and make our voices heard. We have to tell them what's going on in our shop, what's going on with our residents. And I mean, we work hard up there. Trust me. We knock door to door to door, and we try to tell them everything we know. And I'll be honest with you, it's terrible. The fact that I believe his name is Albritton out of Punta Gorda that wants to is supporting this bill, or he's the one that submitted the bill or something.
Yes.
The SB 804.
Right.
I mean, are you kidding me? I wonder if he has ever worked in a nursing home a day in his life, or even stepped foot in one, because this is just, it's going to set us back 30 years, and it's not safe. What he's doing is not going to be safe. It's going to cause a huge problem in the industry.
So I was looking over this bill. It's Senate Bill 804. And what it does is basically, right now you have it's called it's 3.6 hours on average of licensed care, which would be an RN or LPN, and CNA care specifically per resident per day. And so that means, like, if I'm able to get up and feed myself and walk around, and maybe I just need some direction, I don't need that whole amount, but the person next to me might need more. So we average the amount. However, it specifically covers just RNs and CNAs and LPNs and CNAs, right? That's direct care. That's nursing care. Now they want to add into those numbers physical therapist, occupational therapist, all the other therapies. They want to count in that number. And it also says you can't have more than 20 residents assigned, which 20 seems to be too much. And it also says the nurses, the licensed care can't have more than 40. 40 is a lot of people.
Yes, it is.
So when I was looking at that was about 20 minutes per 8-hour shift for the 20 for the CNAs, and it's about 10 minutes for the nurses each person. And that doesn't sound like enough to me.
No.
It doesn't even sound like it meets the 3.6, but and it was also averaged over a month instead of a week. And so one thing I learned when I first got to Florida, I had a job briefly at a small hospital, and we were very full. We were over full in the winter, right, during season, and it practically closed down in summer. And they told me they were 125% full in the winter, and they were down to 50% in the summer. So they staffed for 75%. And I was like, well, that's good if you're in the summer, but in the winter, you're kind of understaffed.
You bet.
Right?
You bet.
So if we average this over a month, and you have a fluctuation in census of your residents, that can be a problem, right? Because if you're on the high end of the month and not the low, you're not getting as much care.
Yeah. And I think that's what people need to understand is that kind of them allowing that kind of thing where they can average it out over a month or a week or whatever it is. That's where the trouble comes in. They should be accountable for every single day, because these residents deserve that care every single day, and they're not getting it.
No.
And who enforces that staffing? Like who comes around to check and make sure?
Well, ACA does.
How often?
Yeah. Well, once a year, unless there's
Once-
complaints, but
Yeah,
mainly once a year.
complaints.
Yeah.
The
But
complaints.
it's
yeah.
really up to you, like they say you have to post it, but it's really up to you to notify ACA,
Yeah, correct.
right?
Correct. And if
And-
you'll ever notice the fact that when it is time for ACA to come in, you don't have those 20 residents. You're not being asked to take care of 27 residents.
No, no,
You
no.
you may have 10.
Yeah.
Which you walk in, you're like, state's here.
Yeah, because
We're all ready to
everybody
go.
is helping.
Yeah.
Right,
And
right.
the minute they walk out the door, you go right back to the 20 or to the max.
Yeah, the same thing.
You know, I said that once in a Senate hearing because it was a nurse staffing for hospitals and it was not going to pass. And I was testifying and I finally just said, oh, you should see when Joint Commission shows up or the state shows up. Suddenly staffing and this senator almost nearly tackled me. He kept running down to shut me up.
Yeah. I
But
bet.
yes, obviously. I think what people don't realize, which is really important, is how much time in your union work, because you two not only work hard at the bedside, taking care of your residents, you also represent the other workers to make sure you bargain the contracts.
Yeah.
And
That's right.
then you, in your free time,
There's no free
lobby in
time.
Tallahassee for safety standards. And I think that's what people don't understand about healthcare unions and most unions is how much time and effort our great members and leaders put in for the safety of the people they're taking care of, right?
Yeah.
Mhm.
How many hours are I don't even know if you know, how much hours do you spend a week on union?
Go ahead, Shirley.
On myself,
On union work, on
union work?
representing.
oh, it's 24/7, you can say, because even on your days off, they will
Yeah.
call you. There is a problem at work and you need to try to solve it. This problem that they have, It's
Yes.
so they will keep calling you all night. They don't worry about you have your personal things to do.
Right.
No, you need to solve this problem for me. That's what's all it is about now. Just fix my problem for me.
Right, and then not
Yeah.
only fixing people's problems that are employed there, but also trying to maintain the safe level of staffing, trying to maintain the funding, try to maintain the law.
Yeah,
to-
we're
to-
always in
to-
communication with each other, union wise, trying to figure out what we can do to make these things better. We're always trying to figure out what's going on in Tallahassee, how are we going to get there, and how are we going to have our voices heard. I mean, that is like a constant thing. As a matter of fact, I have a meeting tonight.
And also, I know you probably encourage people, and we also have to contribute to PAC and our political action fund.
Sure.
So that if we have to send a bus up to Tallahassee of our CNAs, right? Because Tallahassee, I don't know how close it is to where you are, but it's pretty far from down here in South Florida.
Yeah, mine is I think I'm like 5 hours, 4.5,
Yeah.
5 hours away, but
Miami
it's worth the
is pretty
trip.
far.
I would
It's
make
like-
it. I would make it all the time because it is totally worth it. I was just up there, like last month, I believe, and to talk about the SB 804 bill, and it went rather well. Seemed like people were really listening, and they just have to understand that we need more consistency. We need more staff, and they think there's this grand shortage of CNAs, but yet they have these agencies that are making $18 to $25 an hour, and they're staffing their entire building. So it's there, but it's not in the facility because they don't want to. I mean, they need to make the money. It's just a given. They got families. They got to take care of them. So
Well,
they're
and
going where the money is.
we're in a resort economy. I think people forget in Florida.
Right.
Um,
Yeah.
I always say, you know, non-resort wages in a resort economy. So things are very expensive here. I know things are going up
Yep.
everywhere, but it's not the easiest place to afford to live. We also have threats like hurricanes and things that we have to just filling the fridge to, you know, if a hurricane's coming, it
Sure.
can be quite expensive, or boarding up your house or something like that. So
Yeah. Yeah.
you know, you need a livable wage. So I think one of the things we need people to know, and especially healthcare workers, is that everybody has a state senator that
Mhm.
represents them, right?
Yeah.
Everybody has a state representative and a state legislative body. They may, in Florida, they meet once a year, but they have committees kind of before then. Some states every 2 years, but they also have mayors and city council people and county commissioners that represent them. And if they go online and just put in their address, they can find out who represents them. But I think it's important to know, when you are talking about these bills, that they contact those people, right?
Absolutely.
Mm.
And tell them, you know, I want safe staffing for nursing homes and your bill isn't doing it, right?
That's right. That's right.
And how do your coworkers feel about calling, being active?
Where I work, I just go to them and I'm like, look, this is what's going on. How do you feel about it? We have that conversation, and I'm like, okay, this is what we need to do. We need to make these calls to our
Elected.
representatives, our senators. I mean, we need to call and just keep calling every day. Give them the same message, and let them know how things are going and how unsafe the staffing is, and we don't have the consistency for our residents. And I mean, it's very dangerous for our residents, and I can't stress that enough, because just depression alone, bed sores, I mean, it's all happening because of the decisions that our leaders are making, when they're not even listening to us on how things really work inside the facilities.
And I think people don't know that long-term care, nursing home care in Florida is about 70% taxpayers' money, right?
That's right. And isn't that amazing how all of these seniors, they move from different states down to
Yeah.
Florida.
Yeah.
They put in their life savings into our economy.
Right.
And then one thing can happen. They end up in one of our nursing rehab centers, and they get treated like that.
They don't deserve that.
They don't deserve that.
And
No,
even,
no.
you know, I worked in trauma, and a lot of our trauma patients had to go to nursing homes for rehab,
Sure.
you know, for extra care. Some permanently, unfortunately, if you have, you know,
Sure.
severe injury. And so you don't have to be old to be in a nursing home, right?
No,
That's
no.
true. That's
And
true.
how important, I think, even if you're a hospital worker, you know how important the quality of that care is, because you don't want people coming back into the hospital because they didn't get care
Right.
in the nursing home.
Yeah.
And so,
And that's
I
the other
understand.
side of it,
As
Betsy.
you all talk about the connection between the care and our nursing homes, because I know our time is coming close to an end, I wanted to go back to something I think both Amy and Shirley said around like why it's important for folks to work together, right? To advocate for what they need in the nursing home and up in Tallahassee, or even when we do like local visits to politicians when they're on recess back in our communities. Because these connections that you all are making between, you don't have to be a senior to be in to be in a nursing home. If you have an accident, you may end up there. If you are a senior and this is your care, like Amy said, that you come and you want to get it at a great, at great quality, 8 hours divided by 20 patients, it's only 20 minutes. Most of us, I know my kids, for example, they would take a 20-minute shower and I'm yelling at them about wasting water and wasting time in the bathroom. And that's all the time you have for one resident to, make them feel like a whole human being.
Mhm.
That's not helpful, especially if you're the eyes and ears of the nurses who were there. And we applaud both of you for being active in our union, for being good leaders and surely taking those calls in the middle of the night. But we know that you all can't do this alone. And so if there was one thing that you all would want to say to those who may listen to this or see this, listen to this as a podcast or see it as a webcast, what's something from your heart? And Betsy, I want you to also add in when they get finished, that you should let folks know about why this fight is important and why they ought to be involved. Because as you said, like, we're stronger together. We can get farther together than we can individually by ourselves. And that's what our union is about, making sure that we can get farther together than we can alone. What would be your message to other folks to say, yes, I'm a leader. Yes, I will do this. I will speak up for you, but you got to come along with me. Why do they need to come along with you? And I'm going to ask that for all of you, Shirley, Amy, and Betsy, as you make the connections between our nursing homes and hospitals, for us to go ahead and get close to wrapping up. So I'm going back on mute.
So Shirley, we'll start with you. What's your message that you'd like us to take?
A solution to this, all that's going on, that we need more fundings for nursing care, but it is crucial that any additional money helps patients and caregivers, not into the pocket, that the money don't go into the pockets of the big companies and on their executives. Also, we need more transparency and accountability, because it's clear the nursing home industry can't be trusted to the right thing. The nursing home industry and its lobbyists have been allowed to operate unfairly and unsafely far too long. Caregivers need better pay, benefits, and more training. This will attract, retain, and reward caregivers who can provide the highest quality care for our senior citizens. Legislators need to reject bills like SB 804 that will weaken minimum staffing standards, because our seniors deserve better care, and so do we. Thank you.
Thank you. And Amy, what's your message, and anything different than that?
So my message is, what's on the line here is actual lives. I mean, it's our seniors' lives, but not just that. We have a different kind of people that are being admitted into nursing homes, coming out of hospitals. They're younger. They're harder to take care of. They demand more time. I mean, we have to pull together. We have to fight this, because not only are lives on the line, but there's staffing shortage that we have to address.
Mm-hmm.
We have to make sure that people come into work. We have to pay them. We have to give them benefits so we can retain them, like Shirley said. I mean, there's a lot of things we need to do, but we all need to join this fight together, because this is extremely important.
Mm-hmm.
It could be your mom, could be my mom. Actually, it has been my mom.
Could be me.
And yeah, and it could be me. You're right. But we have to look to the future, and this 804 bill is going to knock us back 30 years.
Right.
And it's going to put more people at risk. That's why everybody needs to join this fight, head to Tallahassee, and have our voices heard.
Excellent.
There's a lot of things on the line in regards to this bill.
And I'm gonna ask hospital workers, and I know as a nurse, I learned a lot when I was in Tallahassee, and I learned a lot from you guys about staffing and safe staffing in nursing homes and what goes on there. And like you said, You are essential. You should be valued caregivers. You are essential for the work that is done in a nursing home. That's why people go there. And as nurses, whether you work in a hospital or long-term care or rehab, quality care and prevention is what nursing's all about.
That's right.
And we're all, in nursing, and that's what's essential. And so we have to value the work, because the work is so valuable. And I thank you so much for being here. So I'm going to ask everyone to look up, if they don't know who their state senator is or their state representative, and call them. That's all you have to do, is make a call and say who you are and where you live. And I'm I'm a voter. You have to vote too, but I'm a voter, and I don't like this nursing home bill it's Senate Bill 804. It has one in the House too, but I'm a health caregiver, and this doesn't work. And so that's all they have to do. And I know you'll be coming out in a little while with more information on this. So we're going to be following you and the whole campaign. And thank you for hanging in there. Thank you for your years and years of service, and all the people you've brought joy and care to. You're amazing people. You are heroes, and we appreciate you. And thank you for being on our show here.
Thank you, Betsy.
Thank you.
So we thank you for joining us for this episode of the Nurse Betsy Show. You'll be able to find links to resources and information on where you can find your state senators and how you can be more involved in our union right here on our 1199SEIU.org website. To everybody, have a good morning, good afternoon, good evening, and good night.
Thank you.